Hello, everyone, and welcome to today's webinar on optimizing patient blood management and the role of the laboratory. I'm Eva Maria Sohmann, Product Manager for Northern Europe at Ortho Clinical Diagnostics, and I'll be your moderator for today's event. Today's educational webinar is brought to you by LabRoots and sponsored by Ortho Clinical Diagnostics. I would like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want at any time during the presentation. To do so, simply type them into the Ask a Question box and click on the Send button. If you have trouble seeing or hearing the presentation, you can report your problem by clicking on the Ask a Question box located on the far left of your screen. I'd like to now introduce our speaker for today's webinar, Cecilia Scarponi, who is the clinical liaison for EMEA at Ortho Clinical Diagnostics. For a complete biography, please visit the Biography tab at the top of your screen. In the first part of the talk, Cecilia will give you a brief introduction of the concept of patient blood management, which plays a critical role in the management of severely ill, neonatal, cancer, and elderly patients. She will then cover the so-called three-pillar matrix of patient blood management and discuss how the laboratory can make a difference in patients' outcomes through effective patient blood management programs and practices. I will now hand over to you, Cecilia.
Thank you. Thank you very much. Well, first of all, good afternoon and welcome to everyone. As anticipated, just anticipated by Eva, here's the agenda of today's webinar. I will introduce the concept of patient blood management. Then I will introduce the three-pillar metrics of PBM, as well as the role of the lab, the lab can play in patient blood management strategies. So let's now introduce the patient blood management concept. So here's the definition of patient blood management by the Society of the Advancement of Blood Management. So the timely application of evidence-based medical and surgical concepts designed to maintain hemoglobin concentration, optimize hemostasis, and minimize blood loss in an effort to improve patient outcomes. And these are keywords because we can see that the definition presented by the Society for the Advancement of Blood Management, as well as several other definitions of patient blood management, have moved away from placing the focus only on reducing the use of blood components to the development of a multidisciplinary and multimodal strategy centered on patient outcome. Reducing transfusions might be one of the means, but it's certainly not the end. Thus, patient blood management has moved from a product-centered approach to a patient-centered approach. So the patient blood management concept was introduced in 2005 and endorsed by the WHO in 2010. But many hospitals still seek guidance with the implementation of PBM in clinical routine. So, as already anticipated, well, certainly there are specific patient populations that are more likely impacted by an optimized blood management. These include critically ill and ICU patients, neonatal patients, oncology patients, as well as the elderly. So let's now speak about this three-pillar metrics of patient blood management. Well, let's describe all of them. First of all, as you can see, optimizing hematopoiesis is the first pillar, which means detecting and treating anemia and iron deficiency, but also treating the underlying causes and optimizing hemoglobin levels. The second pillar is managing anemia. So knowing the patient's bleeding history to develop the appropriate management plan, as well as estimating the individual's tolerance to blood loss, but also optimizing the cardiopulmonary function. The third pillar is minimizing bleeding and blood loss. And this is meaning identifying, managing, and treating bleeding and bleeding risk, including coagulation testing, which is not detailed in this presentation. Also minimizing phlebotomy and plan and rehearse different procedures. So through all these three pillars, we can say that indeed the lab can have an impact on each pillar and each strategy belonging to these pillars. So, well, first of all, the lab, we have seen that one of the strategies is detecting erythrocytopenia and iron deficiency. And while the demand of unnecessary testing should be avoided, the Clean Lab has a range of tests available to support clinicians in diagnosing anemia. And I want to say that also Victor's anemia panel include assays that really perfectly fit this indication, like vitamin B12 and B12 and folate, as well as direct total iron binding capacity, but also iron and ferritin. So there is an important aspect here to take into account, which is iatrogenic anemia. So the development of anemia due to medical procedures is a universal concern among critically ill patients. Anemia is common in critically ill patients admitted to the ICU, to the intensive care unit, with 90% of patients having an abnormally low hemoglobin level by their third day of stay. Half of them would require ultimately a transfusion. And critically ill patients are at particular risk for adverse consequences from anemia, given the cardiovascular, respiratory, and metabolic compromise frequently encountered during critical illness. While phlebotomy and blood testing to inform clinical decision-making is vital, strategies have been developed to minimize unnecessary iatrogenic blood loss. And although blood draws can be dramatically reduced by the use of blood conservation strategies, research suggests that they are not widely practiced in all adults, pediatric, and neonatal ICU patients and departments. So let's have a closer look now at the impact of phlebotomy on patient blood management. Well, the amount of blood circulating within an individual depends on the body structure as well as the weight, but an average human adult has nearly 5 liters of circulating blood. The large number of ICU patients who develop anemia and the contribution of blood taken for diagnostic testing to its development is a long-standing concern. So just to give you some figures, I mean, patients who develop anemia, obviously, as we said, has poorer outcomes and higher risk of mortality, whether or not patients are transfused. So previous reports of blood volume drawn from critically ill adult patients average between 41 and 377 milliliters per day, which is huge. The described daily average blood sampling volume varied, well, obviously depending on population studied, the length of stay evaluated, but also the methodology of the study. The highest volumes are commonly encountered in the immediate post-operative period and reaching up to 660 milliliters. Well, phlebotomy-related blood loss is even more profound and consequential in neonatal ICU patients. These infants indeed lose 10 to 90% of circulating blood volume to phlebotomy in the first 2 weeks of their life. So, and it's also finally worth noting that most of the blood drawn for lab testing is discarded at the end. So now let's speak again at the role that the lab can play in PBM progress. So I'd like to highlight the Australian National Blood Authority definition of patient blood management approach. So this approach requires identification of critical opportunities in the continuum of patient care, the coordination between different disciplines that can reduce the likelihood that a patient will require an allogenic blood transfusion. So strategies aimed at minimization of blood loss should be considered as part of routine blood conservation efforts. So a key element of PBM is prevention of blood being unnecessarily drained from patients by reducing phlebotomy blood loss within daily lab analysis. And this can be achieved in several ways, in different ways, but here I want to highlight 4 of them. First of all, minimizing sample test volume. Secondly, when sampling blood, phlebotomists should use the smallest possible collection tube size for the required analysis. In addition, reduction of the number of collection tubes can be achieved, and using a technique using a technology that allows to get results right the first time is also a crucial aspect. Let's then detail all these 4 different ways and aspects. So first, minimizing sample test volumes. So, well, as shown in this picture, now I'm focusing on pediatric patients. So blood collection and lab testing in these pediatric populations present multiple challenges, as you all know. So draw volume limitations, vein collapse and access collapse, high hematocrit, labeling issues as well. So many of these challenges result in low or insufficient serum or plasma volumes that are available for testing, and potentially also trigger a no reportable lab result, which is even more dramatic. So on the graph on the top right side gives an idea of the elevated number of tests that are performed on an extremely low body weight infants. I remind you, less than 1 kilo weight. And these include particularly electrolytes, glucose, bilirubin being the most common tests. So as you can see, it may go up to 150 tests that are required, and also these increase depending on the length of stay of the hospital in the ICU. So a series of vitreous XT microslides with dual test capability has been developed, intended to reduce sample size, and while at the same time maintaining analytical performance versus the conventional single assay slide. So as we can see in this table here, the total sample volume required for the most common pediatric tests is 77.5 microliters, thanks to the slide, and it's even lower when double slides, so XT microslides are used. So it's around 60 microliters, which is really a tiny little amount. So in addition to that feature, vitreous technology includes smart metering features that automatically checks for bubbles and clots or debris whenever present in a sample. So this would ensure that the sample integrity is maintained and would guarantee that results are correct. There is an additional feature which we call Save the Sample, which is really particularly useful whenever the sample volume is limited and so pressure, particularly in pediatric samples, but not only limited to them. And this is that whenever the proboscis or the sample metering would detect insufficient or any issue, insufficient sample or bubbles or clots, then they will return the sample into the tube. And this is very useful for limited samples. Now let's see and look at the second way to improve patient blood management which is using a small sample volume. So indeed, the use of small sample volumes aims to minimize phlebotomy volume and is really important. So indeed, routine use of small sample volumes in the ICU has proven to significantly reduce the volume of blood loss due to diagnostic testing without adversely affecting lab operations. And these might ultimately reduce the transfusion requirements, which are associated to elevated risks for patients as well as costs. Okay. The use of smaller tubes may reduce also the severity of phlebotomy-induced anemia without, again, compromising the lab test procedures. So really, small tubes are one of the components of the crucial components that can impact patient blood management. Focusing now on vitreous platforms, I want to mention that vitreous systems have a universal sample trays that can accommodate a variety of collection tubes, including micro collection containers, micro cups with volumes as small as 0.5 milliliters or 2 milliliters cups, but even smaller containers. And small sample volume tubes are compatible with vitreous automation solution with minimal impact on the lab operations, as I mentioned. So another aspect of blood conservation strategies is reducing the number of collection tubes. So whenever possible, consolidating exams on a single tube involves an adequate choice well, I would say is the preferred choice, okay? Vitreous XT integrated systems enable the consolidation of analysis in a unique tube, and this is fundamental. This obviously also goes with a low depth volume that is required, as well as no extra sample that is required to evaluate sample quality indices, hemolysis, icterus, and lipemia, which I will detail and speak about a little bit later. And obviously, I'd like to emphasize that vitreous automation and IT solutions enable intelligent rules to handle testing order, direct sample from primary tubes, but also a fast release of the tube that can be used in other systems, standalone systems, for further testing and analysis. Here, I want to bring you a real, a case study and a customer experience. So, first of all, let's allow me to give some context. In 2020, there is a lab in France that have replaced 4 standalone instruments with a vitreous automation solution, which was comprising 2 vitreous XT7600 integrated systems. So this was the change, and the activity, to give you an idea, in 2021 was an average of 570 patients per day. This change triggered a redesign of the laboratory workflow, and in particular, there were different changes that were applied. So first of all, there was a reduction of specimens from 6 to 3, so half of them, and a consolidation of chemistry and immunoassays in one single primary tube. Secondly, some assays required an internal validation and correlation so that the serum tested could be replaced by plasma testing, and this is the case for vitamin D. The adoption of a specific tubes, which are BD baric for 3.5 milliliter plasma lithium heparin tubes, also allowed or triggered a lot of improvements. Specifically, these tubes do have a mechanic separation and a reduction of platelets in the plasma. These end up contributing to reduce the hemolysis from 2.1% rate with serum to 1.4 rate with BD baric or 3.5 ml plasma tubes. Well, in addition, thanks again to the VITROS technology, water-triggered interferences were completely eliminated, as well as sample cross-contamination thanks to the use of disposable tips. So this is an example where merging the different tube manufacturers together with technology would really contribute in saving, as you can see here, or getting to the impact, the huge impact of 25,000 tubes per year reduction, which is a quantum leap change. Let's now see the last contributor of the reduction of diagnostic-associated blood loss, which is getting the right results the first time, which is a crucial aspect. Well, analytical errors may trigger sample reruns and represent a common challenge. Some samples of very common some examples, of very common interferences are hemolysis, icterus, and lipemia, which can impact multiple parameters as listed in the table here. These interferences, often linked to sample quality, are a common threat to the laboratory, which is often, by the way, underestimated. But, well, however, besides icterus, hemolysis and lipemic, besides this, there are other common interferences. Can be water contamination, and there are many other potential interferences which may lead to erroneous results. To name few of them, paraproteins, specific drugs like neprilysin inhibitor known as Entresto, electrolyte exclusion effect, fibrin clots, but also risk of carryover or heterophilic antibodies are quite common interferences. Definitely, analytical errors are a reason to worry, but let me give you some reasons now not to worry and give you specifics on how we overcome these challenges. Well, microslides bring a solution to interferences thanks to its technology. The challenge of hemolysis, icterus and lipemia can occur on average in about 7% of samples. In the emergency department, this could even go up to 30% of hemolyte samples. So this is a quite common and an impacting issue. The VITROS solution is the spreading layer that could really trap hemoglobin, bilirubin, or lipids eventually present. So for most of the chemistry testing, the impact of HIL is either completely avoided or at least strongly minimized. For our homogeneous and heterogeneous immunoassays, we have the microsensor technology, which measure the potential impacts of hemolysis, icterus, and turbidity by taking a noptic reading of the dead volume of the sample. So if there is a potential for interference, the result would be flagged, and the lab personnel will be awarded, would be aware. Sorry. So another challenge is the so-called electrolyte exclusion effect, which can lead to misclassification of critical care patients as a consequence of incorrect sodium or potassium results. We have seen earlier that electrolytes are part of the pediatric menu, especially at the neonatal intensive care unit, so are crucial assays. So on the left side of the slide, you can see what can happen with indirect ion selective electrodes for which samples are diluted. As long as the sample has normal protein or lipid levels, this is fine, it's okay. But for samples with an increased protein level, like often the case with cancer patients, this result is in a more dilute liquid phase, and the concentration of electrolytes can be underestimated. On the other way, when the protein level is abnormally low, for example, it's often the case of critically ill patients, the electrolyte concentration could be overestimated. And on the right side, the vitreous solution that is presented here to this issue is the use of direct ISE, where samples are not diluted. So another advantage that comes with the use of this slide format is that there are no electrodes to maintain, and calibrations are stable for a very long time, 6 months or even up to 1 year. There is another challenge that we can look at, which is the potential impact of paraproteins, which particularly affect elderly patients, I must say. Many case studies that you can see detailed here have been published about incorrect results in a variety of assays due to paraproteins with wet chemistry in particular. But again, here, with the spreading layer on top of our multi-layer microslide, paraproteins would be captured and do not interfere in the reaction and do not impact the final result. Another extremely common aspect, so last but not least, I want to mention is how poor water quality and impurities generally can lead to inaccurate results. And a variety of different assays that you see detailed here. So again, electrolytes, but also amylase, lactase dehydrogenase, as well as phosphorus, and so on. So the solution resides simply in a completely waterless technology. So there is no connection to any water drain, plus there is no need for use of water at all. Getting close to the summary of this presentation, at Horta, I want to mention that we have these 6 unique vitreous technologies, which are the core of the vitreous analyzer. And as I've just described, they all contribute delivering high quality results, which end up affecting at the end, definitely get it right the first time, and ultimately patient blood management, avoiding reruns, and improving turnaround time whenever possible. Let me now conclude with few takeaways which I find crucial. Well, first of all, patient blood is a valuable and unique resource that should be preserved and managed appropriately. Reducing volume and or the number of collected blood samples is part of the overall blood loss control strategy. But the nice part is that your lab, every lab, can make a difference in patients' outcome through the application of effective patient blood management practices and strategies. So, Vitro solutions encompassing small sample volume, thanks to microslide technology, but also an efficient workflow, support patient blood management by reducing reruns, reducing sample volume, and also the number of tubes that are required for most routine diagnostic tests. Thank you for your attention. I now hand over to Eva, to the moderator, to see whether we have received questions. I would be glad to answer to.
Thank you very much, Cecilia, for this great presentation. I would like to open up the floor for questions now. So if you have a question you'd like to ask, please do so now. Just click on the Ask a Question box located on the far left of your screen. We'll answer as many of your questions as we have time for today. So let's get started. Cecilia, you mentioned different strategies that could contribute preserving patient blood. Are there preoperative lab testing indications to evaluate the patient's hemorrhagic risk and eventually the need for a blood transfusion?
Oh, well, yes, indeed. I think a thorough pre-surgery patient evaluation is crucial to improve patient blood management and, moreover, to assess any bleeding disorder. A complete anemia assessment, which include hemoglobin, but also hemostasis and coagulation tests like prothrombin time, complete blood cell count, and including platelets, are extremely helpful, I would say, in identifying hemostatic defects that could then cause an excessive bleeding. So knowing the patient thoroughly before would really minimize the risk of bleeding and all the negative consequences. And we have seen that particularly just after surgery, patients may be subjected to many diagnostic tests, and therefore anticipating any possible bleeding disorder really is crucial. Very interesting question.
Great. Thank you, Cecilia. So, Cecilia, you also described a lab experience in France, ending up with a really impressive reduction of the number of tubes used. Were there additional effects of the implemented changes?
Oh, well, yes, I made it short in the presentation, but indeed there were many positive side effects to that experience. Well, the lab personnel highlighted that the improved workflow allowed to streamline logistic aspects linked to tube storage, handling, disposal, as well as to better handle the peak time due to start samples, so short turnaround time samples, because the routine flow was really handled in a more efficient way. In addition, this combination that I described in between BD Barricker tubes that reduce the sample hemolysis thanks to an appropriate vacuum technique, but also a very thorough training of the personnel, the phlebotomists, would combination together with the vitro technology, which is, as I mentioned, assessing the sample quality, reducing the impact of hemolysis on test results. So this combination was really addressing both the pre-analytical and the analytical aspects that could really negatively impact turnaround time. So I think it's an overall very nice experience, plus really concretely shows that reducing the number of tubes is possible thanks to really a new rethinking or a paradigm shift with the aim, with the, the focus in mind of patient blood management.
Thank you, Cecilia. Great answer. So, as we learned today, specific patient populations are deserving an increased focus on patient blood management aspects. So, there's a question if you have any further insights based on your experience.
Well, yes. Well, first of all, while all patients deserve definitely equal attention, I must say that oncology patients are probably highly impacted due, first of all, to the number of sample tubes that are required for regular monitoring of those patients, as well as the potential impact of drugs on the lab results. So many drugs could interfere with some tests, some laboratory tests, as well as paraproteins can be present, as we have seen and briefly described before. So also hemodialyzed patients, I would say, are well as well are undergoing frequent assessments of the renal functions. So patient blood management is definitely a common objective among a variety of different fragile patients and different medical scenarios. Again, thank you for this interesting question. I would like to be more exhaustive, but I think that every lab has its own experience on and depending on the population that is served. But indeed, I think that we are not all equal. Not all patients are equal facing patient blood management strategies and focus.
Thanks very much, Cecilia. So this concludes our session for today. Before we go, I'd like to thank Cecilia and, of course, our audience for joining us today. Questions we didn't answer today and those submitted during the on-demand period will be addressed by the speaker via the contact information you provided at the time of registration. Ortho's purpose is to improve and save lives through diagnostics, because every test is alive. For more information about Ortho, please visit our website at orthoclinicaldiagnostics.com. You can also view the webinar on demand, and LabRoots will alert you via email when it's available for replay. Stay healthy and safe, and we're looking forward to seeing you at one of our next webinars soon. Take care.
Thank you. Bye.